All right, so I have Colin Quinn here. He's a 42-year-old male who works in a nursing home with elderly patients, and he also has a son with asthma. And so he has agreed to speak with me in more depth concerning the flu vaccine, because as of yet, he has declined at previous appointments. So, Colin, I really appreciate you speaking with me today, and I am excited to have the opportunity to both explore your concerns and also maybe provide you a bit of information that might help you make an informed decision for you and your family. So, why don't we start with you just telling me a little bit about what you've heard about the flu vaccine that concerns you?
Well, sure. I appreciate you taking the time to talk to me about it. I'm a little trepidatious about, I don't want to get the flu, and I've heard of people who've taken it and gotten the flu, so I kind of want to avoid that. And then I also heard some other side effects. I'm not sure if this is true or not, or to what degree this is, but there's some paralysis risk if you take the flu vaccine, and I certainly don't want to go through that.
Those are really good concerns because nobody wants to miss work, getting sick from a vaccine. So basically what we know is the actual side effects that a person who takes the flu vaccine might experience. One is a local reaction. So in the arm that you get the injection, you might have redness, swelling, a little bit of tenderness. That should resolve in 1 to 2 days. Not going to keep you from going to work. Then other people have more of a kind of all over body symptoms, including possibly headache, fever, muscle aches. And those also are not severe where you would need to miss work. 1 to 2 days, they'll resolve. So that's what we know about the vaccine. There is some conflicting evidence regarding the paralysis that you were mentioning. There's a syndrome called Guillain-Barré, and it is a known adverse effect to some vaccines. However, with the flu vaccine, as I said, there's conflicting evidence. There's some research that suggests there's absolutely no association whatsoever, so they're not related. The flu vaccine does not cause that. Then there's other research that shows it is possible, and the incidence is like 1 to 2 people out of 1 million vaccines given. So although Guillain-Barré, as you said, paralysis, that's very, very serious. If it is something that happens with the flu vaccine, it's very, very rare. And in addition to that, all vaccines go through rigorous safety testing. And in the past, when a vaccine has been shown to cause any kind of serious adverse effect, if it happens with any huge frequency, they've been taken off the market. So like in the 1980s, there was a vaccine for rotavirus, which is kind of primarily a childhood illness, and there were some pretty serious side effects. So what they did was they took it off the market and they designed a new vaccine that now is used. So that's something to maybe think about as well.
So am I taking back to the side effects versus the flu? Am I taking a live virus or?
No. So the one that's injected in your arm is a killed virus. So it's not capable of replicating, and it's not capable of creating illness. The confusion kind of results from the fact that if you get side effects from the vaccine, like headache, some mild body aches, maybe a low-grade fever, that mimics kind of the symptoms of flu. When you get the flu, it's more like a 4-day event, high fever, very, very sick, maybe even respiratory symptoms, that kind of thing. So it is similar, but not exactly the same. So I think that's where sometimes the confusion results, because it is an approximation. You get the vaccine one day and the next day you start showing these side effects.
I see.
Easily confused, yeah. The other thing I wanted to ask you is, would it be okay if I shared some information related specifically to your situation of, working with the elderly and having a son with asthma?
Sure.
So with the elderly, something we have to consider as healthcare providers, One is they're very vulnerable. So as you age, your immune system does not protect you in the same way that it does when you're a healthy middle-aged, man. So what does that mean? That means if one person gets the flu vaccine in your nursing home facility, about a third of all the residents will get it. It's that contagious. And even if they're vaccinated, which in nursing homes they do a great job of getting their residents to get vaccinated, they do not respond as robustly to the vaccine as do you and myself. So we get protection and theirs isn't quite as good. So they're really dependent on the people that work in the facility, the staff, to be vaccinated in order to protect them from the flu. About 48% of the staff, if they get vaccinated, will decrease the incidence of the high incidence of mortality or death, the number of hospitalizations, basically severe consequences of the illness. So there is definitely a huge effect that getting half of the staff to be vaccinated has a good effect on the health of your residents. The other thing to consider is it's a known fact that if an elderly resident were to get the flu, it puts them at higher risk for things like heart attack and stroke and kind of an overall decline in their health. It really, kind of takes them down a notch. So they might see that they're more frail and even have, cognitive changes. So it's not just, the flu itself, it's kind of the aftermath for an elderly patient.
Well, I certainly love my residents. I wouldn't want to put them in harm's way. So
yes, I appreciate your commitment because in a nursing home situation, I would imagine you get really attached to your residents, and,
for sure.
And you wouldn't be doing your job if you didn't care for them and want what's best for them. So definitely appreciate that. So the other thing is your son. So your son with asthma, I don't know how well controlled his asthma is, but I would imagine that when he has a respiratory illness, which, school age kids are going to get sick, he can have kind of a flare, an exacerbation in his asthma, and you've got an asthma plan that the pediatrician has helped you with, so you know what to do. Sometimes you have to call your pediatrician or even maybe be seen, and further treatment might be required, an antibiotic or a steroid or something like that. But typically, kids don't have to go to the hospital. They don't end up on a ventilator. They don't end up with these, serious consequences of their illness. However, when they get the flu, they do have more of a serious response, and typical treatment doesn't work as well. So there's an increased incidence of treatment failure. There's an increased incidence of hospitalization and complications. So by you getting vaccinated, that can protect your son from getting the flu, because if you don't get it, then you can't pass it on to him.
Should he get vaccinated?
It is recommended for everybody in the household to get vaccinated, including the person with asthma.
Yeah, once again, I wouldn't want to put my family at risk by my inaction.
Right.
Something.
Right. Yeah. So it's an important decision, and it's kind of weighing, as you've stated, that you do not want to get anybody sick or contribute to that in any way. And the kind of the difficult situation is sometimes people will get the flu but have a subclinical case, so they don't exactly show symptoms that would alert them to stay home from work, to protect other people from getting the illness, or stay away from your child while you're ill and recovering, and you can transmit the virus during that time. So you might not be showing symptoms, but you still have the virus. So that's another thing to consider. Kind of puts you in a sticky situation where you unknowingly pass the virus.
Without even feeling sick myself.
Right. Or, you might have mild symptoms, but you wouldn't necessarily stay home from work or refrain from kissing your son goodnight.
Yeah,
Something like that. So Do you have any other questions that I could help you with?
No, I mean, I came into this discussion kind of staunchly against it, but you've given me a lot to think about, and kind of, I probably need some time to think about it and maybe discuss with my family.
Okay. Well, if you're okay with it, what I'll do is I'll send a document through your portal that has all this information so that it'll be easier to share with your wife and family, and also I'll put some references in there so that you can do a little bit of your own research, just so that you know the information I gave you today was accurate. And then maybe if you do decide you want to get the vaccine, you can give our office a call and schedule that. If I don't hear from you in 2 to 4 weeks, would it be okay if I reached out and just to see if maybe you don't have other questions, or
Sure.
I can help you in any way? Okay. And then the other thing I wanted to ask you is just to kind of what you thought about the strengths of my communication with you today, if there's any areas of improvement that you would recommend, or what the overall effectiveness of this interaction was. We, going forward, definitely want to be able to have these conversations with patients, and we want it to be a positive experience. So I'm just asking if you have time right now just to give me a few quick pointers.
Yeah, I appreciate the seriousness of the decision and how you treat it as such, and I did not feel like I'm being bullied into taking it. I just like the information, and also the fact that you're willing to give me some time to think about it. That's an important part of it for me. So I just appreciate the time and your compassion with someone who may not completely align with taking it, although now that I have this information, I think it's going to be helpful. You presented a very balanced set of data, so I appreciate that as well.
Well, thank you for your comments. It's our goal for you to have the information you need so you can make an informed decision. And it's truly your decision. It's your health. We're all about respecting bodily autonomy and you making decisions for you and your family. So I appreciate that feedback, and I look forward to speaking with you soon.
That sounds great. Thanks for your time.
Thank you.